cervical erosion. In this book from 1982, there are some things said about it. They said it is at the neck of the cervix, and that there is a change from a pink, smooth condition to a red, grace-like one. And there can be also a slight oozing discharge, which can be green, yellow, or brown, and also low back pain. It is, as the book says, it common, and in particular is it common if a person had a pregnancy, a child. And there's also said that it does never lead to cancer. And most of the times there are no symptoms, and it is just discovered by another routine examination. If there are symptoms, the person should consult a doctor, and then it's examined, and there is then done a cervical smear to exclude that it is cervical cancer. The book is then saying that there can be done cauterization, which is, as the book says, it then painless and quick. And there's been also said that it returns in most of the cases to normal, if not then with cauterization. And that is according to Keith Hodgkin's Family Medical Advisor book on the page 111. But this is no substitute for medical knowledge and also no medical advice. And the positions and views expressed are the ones of the source and not necessarily aligned with my own or the ones of the entity spoken. Hi and welcome. I'm trying to learn medicine. Today is cervical erosion, and after we've done it, we're gonna do squat training. And if you participate in the squat training, then it's at your own risk. And this is here no substitute for medical knowledge and also no medical advice. I'm just trying to read and to understand it, and the book is from 1982, and this is also not really a family-friendly matter. Cervical erosion. It is an alteration in the outer covering of the cervix, the neck of the uterus womb. The outer covering of the cervix has an alteration. It changes from its normal pink, smooth condition to a red, grace-like, I don't know what grace means, grace-like one that often oozes a slight discharge. I don't know what oozes means. So it's changing from pink to red, but I think it would be important to know what grace and oozes means. The condition is very common, particularly in women who have had children. It is harmless and never leads to cancer. Okay, it is common, in particular after a pregnancy, but it is harmless and does not lead to cancer. Symptoms. Many women have no symptoms. The erosion is only discovered after routine internal examinations. Okay, oftentimes no symptoms, just incidentally, I don't know, incidentally, just by chance discovered by another examination. In others, there is a yellow, green, or occasionally brown discharge, and occasionally low back pain. Okay, but there can be also yellow, green, brown discharge, and maybe also lower back pain. Then you consult the doctor if you have the symptoms described. What the doctor might do: carry out an internal pelvic examination and take a cervical smear to exclude the possibility of cervical cancer. Internal pelvic examination, whatever that means, no detail, and a cervical smear to exclude cervical cancer. Cauterize the area of erosion. Cauterize, that is here to destroy diseased or damaged tissue by applying to it extreme heat, cold, or a corrosive substance or the intense light of a laser beam. What the doctor might do: cauterize the area of erosion. This is a painless and quick procedure. I don't really understand why is it then done if it is symptomless. So I think it's then only done the cauterization if there are symptoms. But why does this then help? How did it come about? Prevention. There are no means of preventing the condition. Okay, 1982. Outlook. In most cases, the affected area returns to normal naturally. In others, cauterization heals the area. They haven't wrote, most of the times they write what the causes or what is happening there. We take what we have. Let's take the dictionary and look up what grace and usus means. Grace is not a good word to find. G has many words. Grace. Perhaps from the combined influence of grate to rub and raise, or perhaps originally meaning to skim along the grass from grass like grace, especially as to rub or touch lightly in passing as a missile does. To brush lightly the surface of, to pass so as to touch or rub lightly, the act of grazing, a slightly rub or brush. Grace like one that often. Grace. To graze or feed. To feed or supply with growing grass. So it must be the other grace. To skim along the grass. To brush lightly the surface. To pass so as to touch or rub lightly, to the act of grazing, a slight rub or brush. Een oes. Double O. Ooze. Wetness. Some root as water, to percolate as a liquid through the pores of a substance, or through small openings, to flow in small quantities from the pores of a body, often used figuratively, with the secret oozed out, to emit in the shape of moisture, soft mud or slime, as at the bottom of any sheet of water. Okay, but that means that it comes slowly out. Grace. It changes from its normal pink, smooth condition to a red, grace-like one. I don't understand that. It often oozes a slight discharge. Okay, we have that. Now we could do the presentation now. But it's better to repeat it one more time, and that's the reason why it's going to do another part. If you were here for medicine, you can go directly to the next part of medicine, and we're going to make a little presentation and say what was written there about cervical erosion. Again, this was not medical advice or a substitute for medical knowledge or something. I'm just trying to read it to understand it. If you were here for that, you can go to the next part. If you stay here and participate in squat training, when it's at your own risk. One leg up, point with a foot down. And toes up and down. And circle. Other side. Other leg up. And up and down. Circle. Other direction. And take one leg at the ankle. And tuck the tail in. Change. And one leg to the side, and we're stretching the inner side of the leg. And to the other side. And go from side to side. And now the squats. So legs wide apart, and we're doing 12. Number 1 and 2. 3 and 4, 5 and 6, 7 and 8, 9 and 10, last 2, number 11 and 12. And now now the 6-back squat squeeze. Quarter squat and press against the top part of the leg. And on the other side. Half squat and press in the middle of the leg. And other side. 3/4 squat and press close to the knee. And the other side. And then up. And now the fastest giraffe of the water pond. 3/4 squat, press against the knee, go towards it. Other side. Press towards it. Press towards it. And 2 more. Press towards it. Towards it. And up. And the last exercise, the propeller. Full squat. Arms to the sides, over to one side, press against the leg. Middle, other side, press. Middle, up. And one heel onto the ground, pull the toes in. And the other one. And one leg up. The other one. Take one leg at the ankle. Tuck the tailbone in. Change. Arms, legs to the side, spreading it out. Out, in and close the legs. And out. That was the squat training. I thank you very much and until next time.